Hi, this is Dr. Yolie. Are you feeling sick? It might be related to your teeth. We are living in a really great time where people are highly motivated to take kind of ownership for their health. Nowadays, people are not trusting the media, they're not trusting the doctors, they're not trusting the pharmaceuticals, so people are becoming more educated. So just think about it. If you had a dead rat in your home, would you be thinking about hiring the painter, bringing a decorator? No. It's starting to smell, you have to get it out. When you have a dead tooth inside your mouth, it is a dead rat. It is a foci that is interrupting the functioning of your body. Your body and your immune system is identifying this as a problem. Now, obviously, some people are healthier than others. They have a genetic predisposition better than others. They have a better diet than others. They sleep better. They're more active. So all those different factors are going to contribute to determine how you are going to react to what you have. But if your mother was a smoker and you have 16 mercury fillings and 4 root canals, no matter how much you work out, how much you eat spinach, you have a problem. You might not understand why you have foggy thoughts. You might not understand why you're so depressed. You might not understand why your libido is not as it was when you were younger, and you think it's because you're getting older. It's not. It's because you have a toxic load in your mouth, and it has to be removed. So many doctors are becoming biological doctors with a more holistic approach. What does that mean? It means that these people all went to medical school. A DO goes to medical school as an MD, but they have a different approach. So when you are interviewing a doctor, you want to know what their approach is. If they're writing a prescription like 5 minutes into the conversation, you might as well walk out, because that person has no knowledge of you. What do you eat? What is your lifestyle? What are your thoughts? You need somebody that's going to be part of a team of people that are going to help you achieve optimum level of health. So welcome to our practice. This is what we see. We see sick people with conditions that are connected to what they have in their mouth. So I have a 40-something-year-old woman that says, I'm here because I cannot remember one day from the other. This is affecting me to a degree. I'm going to lose my job. So we are checking her mouth, and Lord and behold, she has a mouthful of mercury. As we're speaking, we notice that she has beginning of dementia. She's in her 40s. What does she need to do? She needs to have a very, very serious team of people that are going to help her get well. She doesn't need a dentist that's going to remove mercury without protecting her. There's protocols that were created by international organizations to help people, dentists and patients, to follow protocols to protect them from the toxicity of these metals. So one of the protocols is called SMART, and if you are going to have a dentist remove your mercuries and heavy metals, you must ask him, what are the protocols? Do you follow the SMART protocol, which is one of the protocols? We combine a few protocols, the Huggins protocol with SMART protocol and other things that we have created ourselves, because we don't think that there's only one way of doing it. You have to have multiple approaches, from what the patient eats the day before, what they eat that morning, what intravenous vitamin C as we're getting it out, and after we get it out, also, what do the patient do? So I just had an article on Natural Awakenings talking about, are you feeling sick, and what we find is that once you remove the disrupted foci, the part of the mouth or the tooth or whatever is it that is creating the problem, when the patient goes to the doctor, then the doctor has a good place to start. What you have in your mouth is going to affect the gut bacteria, so it's going to disrupt your biofilm. So that would be a first step for the doctors to start working with you and giving you prebiotics, probiotics, and start to build your gut bacteria. Then after that is built and regenerated, then you have your colon and the intestinal flora. So once you start healing from here, then you have the opportunity to regrow everything in the proper balance of biofilm. And then we see amazing healing processes. We have doctors that are so thorough that refer us patients, and we see how beautiful the transformation and the process of healing. And I just want you to have hope. Sometimes you don't even know the basics of where is this coming from. And we will help you in terms of finding other things that you can do around your home with the water, the quality of water, reducing the EMF, and the diet. You are what you eat, and let food be your medicine. It was Dr. Yolie. It was nice chatting with you again. Thank you. So you wanted me to speak